Dr. Bonds, in full disclosure, I'm getting ready to be a nurse, and I work in the pulmonary unit. So can you explain, because people do have concerns, the worst case scenarios, if we didn't take any of these measures, what would happen? I know what would happen. I see it. So I would like you to explain to the public, if we didn't take any of these protective measures, and yes, we have a 99% of whatever the recovery rate, that's what we want to see.
Right.
But if we didn't have any of these measures in place, what would it look like? Because I think that's the part that people are not understanding.
So if we just if we let herd immunity run its course, which is a strategy that has been proposed, like no preventive measures, we're just going to let people get sick. So what would happen is, one, our hospitals would be completely overwhelmed, right? Because we're not going to let people sit at home and die. I'm going to take my parents to the hospital, and I'm going to demand that they do everything they can for them, which is going to fill up all of our ventilators. I mean, we saw this in New York, right? New York was essentially a test case for this. The hospitals were completely overfilled. They had to set up field hospital tents. They had no ventilators. They ran out of healthcare personnel. They had to import healthcare personnel from all over the country to help staff those hospitals, and the death rate went skyrocketing, and people died. So I get wearing a mask, it's really inconvenient. I totally get that. On the other hand, it's a really small inconvenience if I'm keeping my neighbor safe. And so I don't think this is that big a deal. You can customize them, put political statements on them. I can match your clothes. I'm not matching today, but you could, right? You could. I mean, we wear lots of other protective gear on a regular basis, and no one fusses about it at all. This is just one more piece of protective gear. There are lots of things that could be done to help lessen the effects. We could have figured out a better way to provide unemployment insurance earlier, or sick leave for all of the people who need to stay home for 10 days. But those are policy decisions that needed to be made at higher levels. So, in answer to your question, we would have New York.